Referring your patients to a certified veterinary chiropractor may be a decision you have considered with some cases. You may also have had clients ask for these services. Chiropractic Care offers an alternative therapy for some practices to consider with some patients. You may recognize enough benefits from this alternative medical therapy to actually warrant getting additional training or certification in chiropractic care. This program is not designed to equip you with the skills to perform chiropractic manipulations, but rather to help you gain a better understanding of the role of chiropractic care in veterinary medicine and when to refer your patients to a certified chiropractic caregiver. People have enjoyed the benefits of chiropractic care for more than 100 years. Many people see their chiropractor for more than just back pain. They visit their chiropractor for more energy, improved sports performance, better resistance to disease, and to help ensure drug-free lives for themselves and their families. This is known as wellness care, and dogs can realize the same benefits from visits to the chiropractor. Canine Chiropractic Care deals with the nervous system and the structures that house it, namely the skull and spinal column. The spinal cord carries the nerves that are distributed to every organ and tissue of the body, which exit the spinal column between the bones of the spine called vertebrae. Over the course of the past 100 years, the science of chiropractic care has discovered that a misalignment or subluxation of the vertebral joints adversely alters nerve function from and around those areas. Altered nerve impulses leaving the spinal column can in turn adversely affect the function of organs and tissues supplied by that nerve. This altered function can lead to pain, disease, fatigue, muscle weakness, poor balance, and immune suppression. Chiropractic care does not replace traditional veterinary medicine, but may supplement it in certain cases. When a joint becomes subluxated, it loses motion and position. Initially, some subluxations may exist without symptoms. However, left unattended, they will often become symptomatic. The chiropractic adjustment is designed to address a number of pathologies and restore correct alignment, full range of motion, and optimal function. A chiropractic adjustment is aimed at directly correcting the subluxation and indirectly restoring the proper functioning of the nervous system. Kinesiopathology, or the pathology of movement, often starts with the initial misalignment of the joint. In the case of the spine, each and every spinal segment contributes a small portion to the total range of motion in a dog's back. This cumulative motion is what allows a dog to curl up in a ball, change directions quickly when chasing a ball or squirrel, or just allow for a nice smooth walk around the neighborhood on a lazy afternoon. When one segment is not moving correctly, the segments immediately in front or behind may become hypermobile in an attempt to maintain a normal range of motion. Hypermobility leads to degenerative changes and eventually loss of mobility of another segment. The loss of function in one spinal segment may affect the way the dog's entire body moves and reacts to the world around it. Neuropathology is the adverse result of kinesiopathology that leads to problems in the nervous system. In the case of a vertebral subluxation or misalignment, the nerve that exits the spinal canal between those two vertebrae may become irritated, resulting in pain, heat, swelling, muscle spasm, and loss of motion in and around the area. Scientist Chung Su at Colorado University has discovered that the weight of a feather can decrease nerve transmission by up to 50%. The nerves of the spinal cord transmit impulses from the brain and spinal column to the rest of the body and then back from these remote areas to the central nervous system in order to coordinate sensory perception and movement. If their transmission is impaired, the result will be faulty input and output from the brain and spinal column to the rest of the body. If a dog doesn't really know where his legs are, how can he quickly bring back the ball or negotiate around obstacles? Nerves are extremely sensitive, and even a slight amount of pressure can adversely affect their function. Myopathology includes the tightness and spasms that occur in the muscles supplied by the nerves exiting the vertebral canal between the subluxated vertebrae. The tightness can be isolated to the small muscles that connect one vertebrae to the next, or it can extend to the long muscles that run along the entire length of a dog's back. This tightness can cause pain and weakness in the muscle and may lead to changes in the curve of a dog's spine. If muscles are not kept mobile, they will eventually atrophy from disuse. Vascular pathology describes the alterations in blood flow in and around the subluxated vertebrae that can affect nearby or distant cells or organs. Blood vessels enter the spinal canal between the vertebrae along the same path as the nerves. These vessels carry the blood supply into the spinal column and provide blood supply to the spinal cord, vertebrae, and nearby joints. Swelling in the area will cause decreased blood flow through the vessels supplying blood to the spinal joint itself. This can lead to increased joint stiffness and spinal disease. Connective tissue pathology includes the changes that are seen in the tendons, ligaments, and supporting tissues in the area of the subluxation. Immobilization of these tissues leads to profound degenerative changes in as little as 3 days. One change that can occur is the shrinking of cartilage, which increases its susceptibility to damage from minor trauma. Adhesions start to form, which further decreases mobility in that area. Ligaments may in turn start to shorten, leading to tightness in the area. Fortunately for the canine patient, most of these changes are improved by a proper chiropractic adjustment. The inflammatory response includes the swelling, heat, redness, altered function, and pain that are the body's response to inflammation resulting from the subluxation. This is the most common reason that people seek out chiropractic care for themselves or their dogs. Nerves surrounding an inflamed area become hyperexcitable, and they'll continue to discharge impulses even after stimulus has been removed. The pain from a subluxation will vary depending on the severity and acuteness of the problem. Pathophysiology details the adverse effects that all these changes have on each other. Proper body function relies on constant and accurate feedback from the organs. One example of pathophysiology is the increased adrenaline secretion that results from the adrenal gland's response to pain caused by subluxation and myopathology. Increased adrenaline in the body causes a decreased neurological impulse and blood supply to the skin, mucous membranes, reproductive and digestive systems. The mucous membranes may dry out, causing difficulty for immunoglobulins to cross them, which can in turn lead to respiratory problems. Adrenaline decreases secretions in the digestive tract, which can lead to gastrointestinal symptoms such as indigestion or bloat. The immune system is suppressed and the body becomes more susceptible to all types of infections. This brief overview is meant to help you better understand the intricate role the nervous system plays in maintaining a healthy pet. In the next program, you will learn more specifically about the chiropractic exam and the chiropractic manipulations performed.